Sexual dysfunction, again, it's a difficult question sometimes because it can be a difficult topic to discuss, but also if patients are in a great deal of pain, they're not likely to be that sexually active. But if they are sexually active, have they noticed any changes in their ability to have sex, which are not related to the pain? You can ask men about erections. Are they able to achieve an erection, or have they noticed that kind of morning erection? If that's normal for them, are they still getting their normal morning erection? That could be a question which would be indicative. And again, for women, if they're involved in sex, are they able to climax? And again, but would that be normal for them?
Yeah. Even more difficult questions to ask, aren't they?
They are difficult questions, but again, if the patient understands the context, everything then becomes a legitimate and reasonable question, and they're quite happy to answer it.
Do you think there is any potential here for a patient? I don't think it'd be successful, but for them to complain that you were asking intrusive questions?
No. If there was any indication of the potential for Cauda Equina Syndrome, and you contextualised your questions before you asked them, I don't think there would be any reason at all for anybody to hold you up on that and say that what you're doing is unreasonable or inappropriate.
Yeah, sure. Okay.
And I would much rather somebody say to me, I think you may have asked an inappropriate question, than you didn't ask an appropriate question.
Yes, and I guess if you did somehow ask these questions insensitively and a patient complained to the General Counsel, it would probably be dismissed at the first stage because you would explain why you'd asked the question, and they might say you need to improve your communication skills a little bit. But
absolutely.
It was an important question.
Yes, and don't shy away from the questions. And whenever I've gone through this scenario hundreds of times, never once has a patient told me to mind my own business. So, I think they understand. And it's about being professional and articulate in the way that you ask the question.